Today I will speak about our recent study regarding delayed cerebral ischemia. These are my disclosures. I'll thank my mentors. So, delayed cerebral ischemia is occurrence of the focal neurological impairment such as the hemiparesis, aphasia, apraxia, hemianopia or neglect or decrease of at least 2 point in GCS which lasts for at least 1 hour and is not apparent immediately after aneurysm occlusion and cannot be attributed to other causes by means of the clinical assessment CT or MRI scanning of the brain and appropriate laboratory studies. So various treatment protocols are available for treatment of DCI. So in this study we compared two well-established protocol, that is intra-arterial nimodipine versus intravenous milrinone. So it was a prospective study done between July 2022 and June 2021. So in nimodipine protocol, drug was injected daily in the involved cervical, carotid or vertebral artery in the angio suite in dose of 3 mg, that is 15 ml, diluted with the normal saline to 50 ml and infused slowly over 30-minute duration. While in milrinone protocol, drug was given as a continuous intravenous infusion, 10 ml diluted to normal saline to 50 ml and then given with variable rate depending upon patient's clinical condition from 7 ml to 15 ml per hour for 5 to 7 days in ICU. So outcome at the end of this study are studied in the form of clinical improvement, that is improvement in GCS by at least 2 points, CT and MRI whether they are showing new influx or not, and with 12 early TCD. So in this study total 34 patients were included, 13 were in milrinone group and 21 in the nimodipine group. So this is the age distribution of the patients and gender distribution. So this was the 7 to 10 day period where maximum patients developed DCI symptoms after the onset of ictus. Patients in the milrinone group compared to the nimodipine group had poorer GCS at arrival, that is 12 versus 13. Location of the aneurysm was most common in MCA bifurcation and second most at ACOM. Patients in the milrinone group had higher Fisher grades of the SH at presentation as compared to the nimodipine group. In 12 hourly TCD analysis, we analyzed the following parameters. Basically, mean flow velocity, PI, and peak systolic velocity of MCA, ACA, and PCA. So by mixed effect analysis of this all TCD data, we generated various time points and plotted graph. In this graph we can see red area represent milrinone group and blue area represent nimodipine group. So this graph is for the ACA spasm. We can see with milrinone group the graph is almost flat, so velocities are not decreasing with time point. So that is not so effective in DCI treatment on TCD. While in nimodipine group, we can see velocities are gradually decreasing in ACA spasm, so it is more effective as compared to the nimodipine. Similarly, for MCA spasm, we can see in both the graphs, velocities are having decreasing trends, but slope of downward trend is more in the blue area, that is the nimodipine group. But we can see blue graph is little bit more wavy as compared to the red graph. So with each 12-year time point TCD, we can see more fluctuation in velocities are there in nimodipine group as compared to the milrinone group. Similarly, for PCA spasm, we can see both groups are having almost flat curves. A little bit effect of nimodipine is there in earlier time points, but overall both the curves are almost flat. After the end of the therapy, more number of the patient in the nimodipine group showed clinical improvement, that is improvement at least 2 point GCS as compared to the milrinone group. After the end of therapy, more number of the patient in nimodipine group showed development of new infarcts, whether these are small infarcts or large infarcts. Combinedly, All infarcts were more in nimodipine group as compared to the Milrinone group. Average length of the stay in all patients was most common and at 11 to 20 days group. So again we can see with Milrinone group patient had shorter hospital stay, less than 2-week hospital stay as compared to the Milrinone group. After the end of the therapy, patients in nimodipine group had significantly less mortalities as compared to the Milrinone group. And similarly, more number of the patient in nimodipine group discharged to home rather than rehabilitation center or having mortalities as compared to Milrinone group. And at discharge also, clinically, MRS was better in Milrinone group as compared to nimodipine group. And similar trend was seen at 21 days and also at 3 months. So this is the overall summary. Among all these factors, statistically only mortality was significant, lower in nimodipine group as compared to the Milrinone group. However, overall trend was more in favor of nimodipine group. So in this case, we can see this was the MCA bifurcation aneurysm on the left side. We can see large hematoma in left ciliary fissure and in left temporal region. So aneurysm was treated, and at the time of discharge, patient was having this final E image CT. We can see large infarct was present. So patient in this case was treated by Milrinone. And in this case, patient was treated by nimodipine. We can see ACOM aneurysm with final CT showing only patchy infarcts. So in conclusion, patients in Milrinone group had poorer GCS on arrival and higher grades of the SH. After the end of the therapy, more number of patients in nimodipine group compared to Milrinone group show clinical improvement, had less than 2 weeks of the hospital stay and discharged to home, but it was not statistically significant. The intracranial nimodipine group had significantly less mortalities. Although overall patients in nimodipine group worked better, however, higher number of these patients developed new brain infarcts on the final CT or MRI, as they are likely to having higher tendency for non-clinically significant catheter-related infarct due to more invasive nature of the nimodipine treatment protocol. Both nimodipine group and Milrinone group protocols were working well in MCA spasm. However, nimodipine performed better over period of time. In group effect analysis for other vessels like ACA, nimodipine was better as compared to Milrinone. However, more fluctuation in MCA mean flow velocities for each 12 early time point was seen in nimodipine group as compared to Milrinone group, because partial wearing of the effect was seen in between 2 12 early TCD settings of nimodipine, which was not seen in Milrinone. Thank you.